Hello dear students. Today we are going to discuss about an important topic which is very important for the clinical examination. But in this video we will be discussing about the theoretical important points, and I would like to make a separate video for the examination practice, like how will we examine. So the topic for today is going to be pulse. Let's jump into the topic. So pulse, we will be discussing them under various different subheadings. Let's see the headings first. First, we are going to discuss about the definition of pulse, then rate of pulse, then rhythm of pulse. Then along with that, we are going to discuss about the volume of pulse, the character of pulse, condition of the vessel wall, and finally we are going to discuss about the synchronicity and other peripheral pulses. And at the end, we are going to discuss about the interpretation part, how we are going to interpret the pulse. So let's get into the first topic, that is definition of the pulse. So what is a pulse? This is the first question the examiner is going to ask you. So pulse means it is a series of pressure waves which are generated inside the artery whenever the ventricle is pumping out the blood. The definition is pretty simple. Just think, whenever the ventricle is pumping out the blood is going to be sent into the arteries, and this creates a pressure wave in the arteries, and that is referred as pulse. Next, coming to the next aspect of pulse, that is rate of pulse. So what do you understand by the rate? Rate as a physical term, it means that how many times in 1 minute the pulse is felt. That is called as the rate. For example, if we are able to feel the pulse 70 times in 1 minute, we call the rate as 70 beats per minute. And what is the normal range of the rate? The normal range of the rate is going to be 60 to 100. Some of the books says that it is 60 to 90. You can take the reference value of 100 also. So whenever the pulse is below 60, what do we call it? We call that as bradycardia. In medical term, the term brady means slow. So anywhere you find this brady, it is going to be slow. Bradycardia means slowing of the pulse. When does bradycardia happen? In athletes who are trained for a longer period, at resting heart rate, they will have a bradycardia. Why? Because their heart musculature is very good. They can send out more volume in single beat. So naturally the heart rate comes down. That is bradycardia. And sometimes when you are in sleep, then also bradycardia can happen. And other than that, whenever there is a failure of the pacemaker node, then also bradycardia can happen. Then when the beat goes beyond 100, what do we call it? We call that as tachycardia. Tachy means fast. So when does it can go beyond 100? Physiologically, whenever a person is doing an exercise, it is going to shoot up beyond 100. And other than that, it is going to go beyond 100 whenever we are excited, anxiety, excitement. All these things are going to cause tachycardia. So this means that whenever the rate goes beyond 100, we call it tachycardia. And some of the arrhythmias we see are in thyrotoxicosis or extreme hyperthyroidism we can see. So these are the few of the conditions where the pulse rate will go beyond 100. And next, coming to the next point, rhythm. First of all, let's try to understand what is rhythm. So when you are feeling the pulse, we are checking for the time interval between one beat and the next beat. For example, a beat is present and next beat is coming. And the third beat also is coming in the same gap, like the same interval between the first two beats. Then we can call this rhythm as regular in rhythm. So regular rhythm means the beats are having the time interval between the beats are very similar. There can be some irregularities also, and the irregularities are generally classified into regularly irregular and irregularly irregular. Don't get confused, I will explain it. First thing is, let's take the example of regularly irregular. So I will give an example for this. So there are two friends. In one friend, he takes every time a holiday on Wednesday. Nowhere in any Wednesday he shows up in the class. Of course, this person is irregular, but he is regular in his irregularity. And there is a person B, his friend. He will take the absence, or he can take leave at any random point. There is no fixed day. He will take sometimes on Monday, sometimes on Wednesday, sometimes on Saturdays also. So this person is also irregular, but he is irregularly irregular. You cannot predict their pattern. So irregularity can be regularly irregular and irregularly irregular. Some of the examples I will give you. A regularly irregular beat can be seen in sinus arrhythmia, as well as any atrial extrasystole. The extrasystole is coming at a regular beat, so it forms a regularly irregular. An irregularly irregular pulse, which is not predictable at all, that can be seen in atrial fibrillation and arrhythmias. You cannot predict it. The rate can go very high or it can go very low. Next thing I wanted to discuss is the character of the pulse. So, character as such, the ideal way to assess a character is using the pulse waveforms. But generally, when we feel the pulse also, we can comment whether the character is normal or abnormal. How do we do it? I said it has to be recorded in a wave pulse. But still, if I don't feel any abnormal character, then we can comment the pulse as normal in character. So some of the few examples of waveforms I will give it along here. So sometimes there will be collapsing type of pulse. Immediately the pulse will come and immediately it feels like as if the pulse is collapsing. This type of sudden upstroke followed by a downstroke is seen in aortic regurgitation. Why it is happening? The regurgitated blood is suddenly going back, so the pulse is felt like as if it is collapsing. Sometimes the pulse feels like as if it is very slowly rising. This slow rising type of pulse is seen in aortic stenosis. Character of the pulse, there are other features which is done on a recording, but generally we can either comment whether it is normal in character or abnormal in character. Next, coming to the fourth character, that is the volume of pulse. So what do you understand by volume? Volume, all of us know that it is the quantity. So here in volume, I am going to count the intensity of the feeling, like how intensely the pulse is felt, whether it is felt normally or whether it is felt low or whether it is felt like a bounding or a high pulse. So the pulse can be, if there is a normal feeling is present, we call it as good in volume. And if it is low, we call that as low in volume. So when does low volume happen? Low volume can happen in conditions like somebody is bleeding, his blood is being oozed out, so he can have a low volume pulse. So the high volume pulse, when does it happen? So somebody is having hyperdynamic circulation. The circulatory volume is more, then they can have high volume pulse. The best example is exercise. Immediately after exercise, you try to feel your pulse, it will be like it is bounding and giving a very good volume. So that is one example. And in pregnancy and thyrotoxicosis. These are few examples of high volume pulse. Then coming to the condition of the vessel wall. So what do you mean by the condition of the vessel wall? Like how the vessel wall is felt. That is the condition of the vessel wall. Suppose you are feeling it in a young person. You are trying to feel the artery in a young person. It will be just palpable. The vessel will be just palpable. But if you try to feel it in an older adult, it can feel hardened. Why this kind of hard feeling is there? It is because they are having the process of arteriosclerosis and it will feel like it is thickened and hardened. This type of condition we can assess through this palpation of the pulse. Then coming to the next aspect of the pulse, that is synchronicity. Synchronicity means whether both of them are coming at the same interval. So where do we assess the synchronicity? When I try to palpate the radial of the patient on both sides, then we can assess the synchronicity. Now when you are palpating the radial of artery of the patient on both sides, we will try to feel whether they are coming at the same time interval. This is called as synchronicity. So one beat is coming and maybe sometimes if the other beat is coming a little delayed, we call it as asynchronous in nature. We not only check for the synchronicity of the radial pulse, we also check for the synchronicity of radiofemoral pulse. In conditions like coarctation of the aorta, where there is narrowing in the aorta, what is going to happen? The upper limb pulse might come earlier than the lower limb pulse. There will be a delayed feeling of the lower limb femoral pulse felt. So that is called as radiofemoral delay. And these are the aspects of the pulse, like these are the main important aspects of the pulse, and I have discussed where are there abnormalities along with it. So all this pulse we generally evaluate in the radial artery. Why do we do that? It is easily accessible and there is not much of exposure of the patient. There are other peripheral pulses which can be felt in the body, like outside the body itself you will be able to feel it. What are those pulses? They are the temporal pulse, then we have the carotids, then we have the brachial and the radial in the upper limb. In the lower limb, we have the femoral, and back of the knee, we have the popliteal, and lower down, we have the tibialis posterior, and in front of the foot we have the dorsalis pedis artery. So these are the pulses which can be felt on the outside. So this is called as other peripheral pulses. And finally, once you have examined all of them, you have to combine this and tell an examiner what is your finding. So that comes to the part of interpretation. So this interpretation, even in your sleep, if you wake up and ask you, you should be able to tell from the start to the end. So let's try out a normal example. So you have to say like the pulses, if you're feeling no abnormality, please do comment. Suppose just everything is normal, I will give a comment for the everything to be normal. But just in case if you feel anything is abnormal, then you should definitely make comment out of it. So first let's try to explain it. So it is 72 beats per minute. It is regular in rhythm, normal in character and good in volume. The condition of the vessel wall is just palpable and there is no radio-radial or radio-femoral delay. And the other peripheral pulses were palpable. So this is how the comment should be there. So let's try an example in a patient of shock. He will have a low volume pulse. So how do we comment? Sometimes the rate can be increased also. So we will comment like the rate is 82 beats per minute and it is regular in rhythm. The character is normal but the volume is low and the condition of the vessel wall is just palpable and there is no radio-radial or radio-femoral delay. So here I have put an abnormality of a low volume pulse. Like that, whenever you are finding any abnormalities, it has to be mentioned in the interpretation. I hope this class was helpful to you. Please do give your comments in the comment section so that I would know like what else to improve and what other things can be done better. And you can put the topics that you want me to do the theoretical aspects of the examination part. And we are definitely making a separate set of practical videos for all this examination part. I hope it helps for your medical journey. Thank you for watching. Stay tuned for more videos. Thank you so much.